In March 2020, the World Health Organization declared a pandemic outbreak of COVID-19. However, there is one disease that remains endemic and is still prevalent in Malaysia since the 1980s. Dengue. We all know that dengue is one of the most prevalent health issues in Malaysia and is still a concern. In Malaysia, dengue fever occurs nationally with its peak transmission occur during late monsoon seasons. We, from Group 1, present to you dengue. Beware of the bite. What is dengue? Dengue or dengue fever is a mosquito-borne viral infection that can be found in tropical and subtropical climates all over the world, primarily in urban and semi-urban regions. Dengue viruses are transmitted to people through the bites of an infected Aedes mosquito, not from an infected person. Based on the data reported by the Ministry of Health of Malaysia, the total number of dengue cases and the death cases this year, starting from January until 6 August 2021, shows a reduction compared to last year. Despite a reduction in cases, prevention still needs to be taken to reduce the risk of getting dengue fever. Before we get into the details about the prevention, let's see how dengue fever is transmitted first.
How is dengue transmitted? In simple terms, mosquitoes, particularly Aedes aegypti and Aedes albopictus, act as vectors to spread the virus from an infected person to another healthy human via its bites. Not only that, a pregnant woman already infected with dengue virus may pass the dengue virus to her fetus during pregnancy or around the time of birth. This is what we call vertical transmission. In the pathogenesis of dengue fever, we discussed how the dengue virus invades the human body to cause symptoms and disease. Firstly, the virus penetrates the skin via the proboscis of the mosquito. The virus will enter the skin together with mosquito saliva. The virus then binds to and enters white blood cells while they move throughout the body. The virus matures inside these cells and is released via exocytosis into the bloodstream that can cause viremia and may infect more white blood cells. The initial reaction of infected cells is to release interference, a type of chemical mediator to limit the spread of viral infections in the body by activating the adaptive immune response to attack the virus, and so produce symptoms like fever, the flu-like symptoms, rashes, and severe pains. Next, let's take a look at the characteristic of Aedes mosquitoes. Aedes mosquitoes are divided into three parts, which are head, thorax, and abdomen. The head has many organs that help mosquitoes eat, see, and smell. Antenna, eye, palps, and proboscis are part of a mosquito's head. The thorax is connected to the head. Wings and legs are connected to the thorax. This part contains halter, wing, leg, femur, tibia, and tarsus. The abdomen connects to the thorax and serves as the stomach, reproductive system, and part of the respiratory system. Besides, here are some other facts regarding Aedes mosquitoes you need to know. First, mosquitoes can bite day and night. Second, adult mosquitoes live for about 2 to 4 weeks, depending on the species, humidity, temperature, and other factors. Female mosquitoes often live longer than male mosquitoes. Third, only female mosquitoes bite people and animals to get a blood meal to produce eggs. Fourth, mosquitoes get infected with germs, such as virus and parasites, when they bite infected people and animals. Lastly, it takes just a few infected mosquitoes to start an outbreak in a community and put you and your family at a risk of becoming sick.
The World Health Organization issued a new guideline that classifies symptomatic cases as dengue or severe dengue. Symptoms vary depending on the severity of the disease and usually begin 4 to 6 days after infection and last for up to 10 days. Clinical findings of dengue fever include nausea, vomiting, rash, aches and pains, leukopenia, and the following warning signs such as abdominal pain, persistent vomiting, and lethargy. However, serious problems can develop. Some patients with dengue fever go on to develop dengue hemorrhagic fever, a severe and fatal form of disease which is characterized by high fever, damage to lymph and blood vessels, bleeding from the nose and gums, liver enlargement, and failure of the circulatory system. The symptoms may progress and lead to dengue shock syndrome. Dengue shock syndrome is defined as any case that meets the 4 criteria for DHF and has evidence of circulatory failure manifested by rapid, weak pulse and narrow pulse pressure, restlessness, cold, and clammy skin. Patients with dengue can rapidly progress into dengue shock syndrome, which, if not treated correctly, can lead to severe complications and death. So, what is the best treatment for dengue fever? Dengue is a virus, so there is no specific treatment or cure for dengue fever. However, intervention can help, depending on how severe the disease is. For milder forms, treatment includes preventing dehydration. A high fever and vomiting can dehydrate the body, thus the person should drink clean water or rehydration salts to replace fluids and minerals. Other than that, painkillers such as acetaminophen or paracetamol can be taken to help lower fever and ease pain. Non-steroidal anti-inflammatory drugs such as aspirin or ibuprofen are not advised as they can increase the risk of internal bleeding. For more severe forms of dengue fever, patients may need intravenous fluid supplementation or drip if the person cannot take fluids by mouth, or blood transfusion for patients with severe dehydration. In case the symptoms get worse, patients need to be hospitalized to be properly monitored. The primary preventive measure to reduce dengue infections is the control of mosquito populations. What can we do to reduce the size of mosquito populations? One recommended environmental management strategy is source reduction. It is by eliminating unnecessary container habitats that collect water, such as plastic jars, bottles, cans, and tires, in which Aedes aegypti can lay their eggs. This can cause the mosquitoes to have fewer opportunities to lay eggs and cannot develop through their aquatic life stages. Also, insecticides can be used to kill mosquito larvae and adult mosquitoes in emergency situations. However, mosquitoes can develop resistance to insecticides, and high doses of it can be toxic to human and other species. Another method of reducing Aedes aegypti is to use ovitraps. The female Aedes aegypti lays eggs in the ovitrap, and when the adult mosquitoes emerge, they are trapped beneath the mesh and are unable to escape. When sufficient numbers of ovitraps are used, the vector population can be diminished. The example is in Singapore, where ovitraps were used to eliminate mosquitoes at the international airport. Biological approaches are also being considered as alternatives to control mosquito populations. Coke pots and many varieties of fish, including mosquito fish and goldfish, eat mosquito larvae. The addition of coke pots into large water storage tanks was successful in limiting dengue transmission in Vietnam. It prevents mosquito development. In the absence of an effective vaccine that protects humans from dengue, limiting contact between people and vectors is the most effective way to prevent dengue infections.
In conclusion, dengue fever is a serious disease that should be prevented properly in order to stop its spreading endemically in Malaysia. So let's work together and minimize the spreading of dengue. Together, we can make a difference. Now, let's move on to the Q&A session before we end our webinar today. Thank you for having us.